Good morning, everyone. Welcome to Health Promotion and Communication in Nursing. I am making this for a specific group of students, but anyone's welcome to listen to it. The concepts are the same, whether you have a bachelor's in nursing, a master's, an ADN, or you're an LPN. So you always have objectives when you go to learn something. You want to be able to define health promotion, and there's 3 levels in here, and every nurse needs to know them. They will come up later in your nursing career. Your nurse's role in promoting health. What are effective communication techniques? What are barriers to communication? And you'll have to be able to do therapeutic communication skills when you are working in patient care. So what do we mean by health promotion? If you look at a dictionary definition, process of enabling people to increase control over their own health and focuses on prevention, education, and early detection. Some examples: immunizations, nutrition education, exercise programs, educating patients about chronic conditions like diabetes or heart disease, trying to teach healthy eating and physical activity habits, counseling someone on stress management, working for health programs in the community, helping a patient coordinate preventative care and trying to access the healthcare resources. We don't do this well in the United States. Anything you're going to read about this is going to tell you we're definitely very low on this. Every country in the world pays through their insurance, through their government for health promotion activities. We've had to fight tooth and nail here in the United States to have health promotion activities paid for. I think some of you may not be old enough to remember the fight over the Affordable Care Act. A lot of people called it Obamacare, but a lot of that was about health promotion. And as soon as insurance companies found out they had to pay for health promotion, they started dropping people off their insurance plans. It was kind of a nightmare. They now currently do pay for age-appropriate health promotion. For instance, if a woman's 45 or older and needs a mammogram, they will pay for that. They'll pay for a colonoscopy for someone over 60. Most immunizations for children, but the insurance companies initially fought that tooth and nail. And we're not a very healthy country because we don't do a lot with health promotion. So there is actually 3 levels of prevention that all nurses should know. And so please don't send, I'm not going to answer any emails. Do I need to know those levels of prevention? Because you do. I'm telling you straight up now that you need to know. The one on your left is primary prevention, and that tends to be, it's anything that prevents illness or injury before it occurs. The usual example is any type of vaccine. Most vaccines are actually safe. I don't care what you heard on the internet or what you heard during COVID. The majority of the vaccines that children receive are safe, and it is better to prevent any illness before it occurs. Another example of primary prevention would be a woman checking her breast at home doing a breast self-exam, or a man doing a testicular self-exam. The one in the middle is secondary prevention, and that's early detection and prompt intervention, any type of screening. So the way I remember this, because I always have to have little tricks to remember things too. I do understand when you guys tell me that. But secondary prevention is something that requires a healthcare person to read or to help me with. Examples: a TB test. I need a nurse to give me the TB test. Whether it be a blood work or the one in my arm, I need a nurse to help me with my mammogram. The tech came out and did a mammogram. There are nurses when you go to get a colonoscopy that help you. That is also considered a secondary prevention. Anything that requires a healthcare person to kind of read a screening and see if I'm possibly at risk for something, and to detect something early. Okay. The one on the right on your screen is tertiary prevention. Managing disease to prevent complications. This is rehab. These are these folks that are in the nursing homes that we see. A lot of you tell me you come from that background at a nursing home, so you've seen the tertiary prevention. Usually the first nursing clinical that even RNs and LPNs do is at this level, because we want to keep it simple, keep it where you learn to do your head to toe. So these three levels come up all the time in other classes. So I don't know what you're all doing to study. A lot of you just do this and you're trying to cram it in the night before the test, and that doesn't work. But you should maybe put these on some flashcards and see if you can memorize these, and you understand that it is our job to promote health wellness. So I'm going to talk about the term holistic. It actually has an official definition, characterized by the belief that the parts of something are interconnected and can be explained by reference to the whole. But I want to give you why it comes up in healthcare, because I don't think that the book definition is helpful to you. The example that I can give you is our current emphasis on people's mental health. We now have a mental health hotline that you can call. You call 911 for medical problems. We now have a number you can call for mental health. And when I was first a nurse, or even when I was a young girl, there was not a focus on mental health. If you had depression, they would tell you to kind of suck it up. We don't know why Mrs. Smith is depressed. She shouldn't be depressed. We now know that people get depressed. There's actually something going on in their brain with their serotonin. And there would be, if somebody was having a hard time or feeling anxiety, we would say, what's wrong with him? He shouldn't feel that way. And we now know that the parts are interconnected in you. Your brain interconnected to the rest of your body. If you are having anxiety or you are having depression, those are all, we need to look at you as a whole unit, and all those things need to be included. So SDOH is social determinants of health. So what exactly are social determinants of health? They're conditions of environment where people are born, live, learn, they work, they play, and affects their health. Okay, it affects their quality of life and their outcomes, how well they do. We know that if you go to Suma Health System right now, they have some posters in the hall. They're asking everyone when they intake you in to the office, they ask you about your social determinants of health. They say, are you able to afford your prescriptions? Do you have a home? Are you safe? And the posters are basically telling you that they're going to be asking you, not because they're being nosy, because they're worried about people and they think they can improve healthcare by asking and see if they can be of help to others. Okay. And so how does this affect you here? Well, you should kind of be just thinking about that this is a concept, okay? And I want you to think about it as you move through nursing school. It kind of comes up in a weird way sometimes. I'm going to say an example I can give you is for pharmacology class. Sometimes you see a pharmacology question and the patient can't afford his medication. Well, he's not going to take it if he can't afford it, okay? And that is a social determinant of health. If he doesn't have the money to pay for the medication, and you guys know that medications are really expensive, right? If you have to pay out of pocket, and that's going to affect this person's outcome. So you'll see this concept come up in some questions as you move along in a nursing program. You may see this in multiple textbooks. Nurses' role in health promotion. We do a lot of education. We do a lot of being an advocate. Try to be a role model to others. We do a lot of with support system, and we also do a lot of care coordination. So principles of effective communication. The big one on the top here is active listening. That's the communication skill you do with patients, and you should be doing with everyone that you meet. It's therapeutic communication versus non-therapeutic, okay? Active listening is a communication skill that has you consciously focusing on your speaker. Absorb the information that they share. Show some genuine interest to ensure you did understand the intent, they're verbal and nonverbal. It goes beyond you hearing them. It requires you to be engaged, like make eye contact, avoid distractions, like your phone, asking some questions, maybe paraphrasing what they're telling you. I cannot tell you how much the phone is killing all of you, okay? You are going to your phone for answers instead of thinking an answer through. You're trying to get through on these sites like ChatGPT. Your phone is killing all of you, okay? I love my phone too. I have my phone and I do use it for like directions to clinical sites and occasionally looking up the weather to make sure we're all safe to get home and that kind of thing. But those of you that can't put it down in class, for me personally, I'm done this term. You're going to have to put it away. But I can see people, they're not actively listening when I tell them something. I can tell them, well, I actually have told somebody that's on the test. They were on their phone, and I swear to you, you didn't tell me that was on the test. Get off your phone. I did. Okay. The second principle that's listed on here says clarity and conciseness. If you don't understand, ask people. Be concise with them. Say, what you're telling me is, Mr. Jones, is your pain has not been relieved by the medicine that I gave you an hour ago. Get specifics. Nursing's specific. It's not vague. The term is on here, empathy. Empathy means if they tell me some horrible story, and sometimes I'm thinking to myself, what the heck were they thinking? I don't say that. I'm empathetic. Nobody wants to walk in your ear and give you some crazy story and then get admitted to the floor where me and an LPN are taking care of it with me not being empathetic to what's going on. Okay? And the other rule that you need to have is to respect everybody whether they deserve it or not. Somebody may be out at the desk yelling at you. You may have a coworker who's trying to dump work on you. Should they dump work on you? Of course not. Should someone yell at you at the desk? Of course not. Put the respect down for them. You have no idea what other people are going through. Okay? You don't have any idea. Okay? And the last thing that everybody has a hard time with is an open-ended question. So an open-ended question is always one that makes you talk to me. Can can you tell my students how what's been going on, that they have all these tubes in you here today? The patient starts telling me his whole life history there. I told the students too what happened. I don't really know at the time when I'm talking to him. I just kind of met him in the hall. Can you tell me what you're feeling today? Can you tell me what you're worried about today? I was wondering if you do you want to talk? Tell me if you want to talk a little bit. Open-ended questions is not a yes or no question. Okay. And when you read a question with practice communication questions, you just run it through the test. If it's a yes no question, it's a closed question. Okay. Open-ended question is how we get people to talk, to tell us what's going on. Can you tell me why the doctor sent you over directly to the floor to me, and didn't send you through admission? Well, he had something bad happen. He didn't want to share the story with everybody, and so I sent him directly over to me and the nurse I was working with. Can you tell me how long you've been feeling like you wanted to die? Can you give me something open? This is what a lot of they use a lot in psych, but this is, you are now in nursing, so you do a lot of open-ended questions. And you tell me how long you've had that. You start asking people, tell me, what do you, what's frightening you? I'm frightened to go to surgery. Let's sit down and talk. You can tell me what's frightening you. I want them to tell me. I need them to tell me. It's not about you, all right? A closed-end question is one that sometimes you do need to do. Closed-end question would be, tell me how many units of insulin you took this morning with breakfast. Tell me how many of this Tylenol you took out of this bottle. Tell me how many of this Dilaudid tabs you took. Dilaudid is a pain med. I need specifics. So sometimes you do need a closed-end question in life. You don't always need open-ended questions, but you understanding that this is therapeutic communication is kind of something that's really, really important, and you are not done with these type of questions. They're going to keep coming up over and over and over again. And so keep in mind that the answer, we never say why. Don't pick why in the question, and we don't say why. People don't know why. It'd be like, why did you eat that whole box of Ho-Hos and you're diabetic? They don't know. Hey, nobody knows how to answer that. Remember, verbal can be spoken or written words. Nonverbal is your body language. Facial expressions, gestures. If you've ever had anybody, when you ask for coffee, I like coffee. That's a running joke here with some of the students. But you ask for a refill on your coffee, and they slam it down and go, "Here's your coffee." Well, that's a nonverbal. I got nonverbal. They're not thrilled to be there. You know, and people ask you for stuff all the time when you're working in nursing, water, or they need a pain pill, and sometimes you got to watch, because your body language and your facial expressions are also communication. And remember, this therapeutic communication is helpful. We want to build rapport. Rapport means people can trust you and talk to you, and they trust you. So there is a difference between, sometimes you need information from people, and people say, and people get aggressive when they're doing communication. It's not okay to be aggressive. It's okay to be forceful if you need information, but you got to watch, because you don't want to come across as aggressive. A lot of nurses do. Just kind of keep it in mind. You want to, there is aggressive communication. You want to be non-aggressive. You can be forceful and get to your answer, but you don't want to be aggressive. So there's some therapeutic communication technique terms. One is to use silence. And can you use silence? Well, sure. Silence is, sometimes people just start telling me. I had a couple of people tell me over the 38 years they lost their son to a murder in Akron a year ago, and today is the anniversary. I really got nothing I can say. I was honest and sincere. I wish I knew something I could make this not a bad day for you, ma'am. Silence and hang onto her hand when she told me about her son. That's about all I got. And there's nothing wrong with that, okay? And the other, so you go down the list here, reflecting. Reflecting means you telling me about your son that passed away. You really seem like you and him were really, really close. I'm reflecting on what she told me. Okay? Uh, Offering self means sometimes I maybe need to help somebody out a minute. I need to get the phone over if they're trying to get a hold of their son at the Kansas Penitentiary and he's not able to dial. I offered myself to be able to do that. If I offer myself to tutor with some of you that aren't in my class, that's me offering myself what I can do to try to help others. Okay. Clarifying means is to say, start out with, so what you've been telling me is they never found out who shot your son. I'm clarifying what she's telling me while she's crying, okay? Summarizing is what you do kind of do after a teaching session. If I teach someone how to give their own insulin, I kind of summarize that they know how to do it now and what we talked about during the teaching session. So those are all terms you're going to see come up in these communication chapters. So, barriers to communication. The first one, the obvious one, is language differences. If someone doesn't speak English, you're going to have a language problem. The hospitals all provide interpreters that you can get a hold of. If you are not in a hospital setting, you may need to find someone who speaks a language to someone. You're not supposed to use their children, but sometimes that's all you have. Most of the children that you run into are bilingual. It's just something to kind of keep in mind. The other thing would be hearing or vision impairments. Quite a few people, especially in the long-term care, are hearing impaired or vision impaired. The hearing impaired people, a lot of times they don't have a working hearing aid. The book kind of recommends that you get in front of them and slow down your speech so they can follow you. The other thing I would say, get a piece of paper and write it out to them. I've done that in a certain situation. And a vision impairment, if they can't see, and you've taken their tray to them, I mean, you need to tell them what's on the tray or what's going on when you come to the door. Say, hi, I'm Mary Beth. I'm the student nurse. How are you today? Make sure they know that you're there. They usually can hear you coming. Cultural differences is also can be a big issue. Some cultures view eye contact as insulting. If you have some cultures, it's something to kind of think about. I grew up, they wanted you to make eye contact. I tend to make eye contact and people say hi to me, but a lot of people don't view that as a positive trait. And the fourth one on this list, emotional distress. If somebody's in emotional distress, they can't always remember what you told them. The last one, environmental distractions, I would say that would be the phone. I've had patients, some of them don't know how to use a phone. It goes 6 to 1, half a dozen. The other, either they don't know how to use a cell phone or they're on the phone and they won't put it down. They have to. I'm trying to get them up and get a brief on them, and the phone rings, and they had to talk on the phone. I'm like, can we call them back, please? Let them know you're okay. I can tell them this is me offering myself, and I'm telling them we'll call you right back. The other thing, the TV's blaring, or they're binge watching something on Netflix, and I get it, but I have limited time. I got to be kind of assertive here, not aggressive, but assertive, and say, listen, I need a minute of your time. I want to turn the movie down here on Netflix for just a second, and then as soon as I'm done, we'll put it back on. So I definitely say that's those types of things are barriers to communication. To kind of summarize the previous slide, use an interpreter when one is needed. You may need to adjust your communication style for people with sensory deficits. Try to be culturally sensitive. Try to provide a quiet, private environment. Validate how other people feel. Validate means you acknowledge that they feel how they feel, and nothing you say is actually going to change that. Applying communication to health promotion. A lot of this is about patient teaching. So we do teach back, okay? You teach back. We need a patient to tell me what he knows. And that's what I ask you. If you ever come to me for help, I say, tell me what you know and explain it in your own words. If you can't explain something that you have learned, then you don't really know it. Okay, that's for the patient. If he can't explain to me how to give his insulin, he don't know what he's supposed to do. Okay, so you always tailor patient education to a patient's needs. You try to kind of do a lot of assessing of them to see what they need. Okay, when you are talking to a patient, you're trying to teach them something. Use plain language. Okay, for example, the word flatus is when somebody has gas. If you ask them about flatus, they may not know. But if you say, I need you to be passing gas in order for us to send you home, most people know what I'm talking about. Okay, if I say flatus, they probably don't know what I'm talking about. Always encourage people to ask questions of you. Okay, you're the nurse. They expect you to be able to answer questions. And you don't have to know the answer to every question, guys. You can say, I don't know. Let me find out. Easy enough. If you do have some key points, reinforce key points. If I need a patient to be having bowel sounds and passing gas before he can go home, reinforce how he can get those bowel sounds. It's usually by getting up and walking. So if I have a talk with them about this, I reinforce what I need them to do. If you ever do some teaching and you have, you can provide written materials. They say that they should be at a 6th grade reading level. Make sure you don't just hand people, you can get teaching material in different languages now too. Make sure you don't just hand somebody something and not know that they understand what's in there and what they need to do with the written materials. It's kind of important because we do want to teach back, and that's how I tell you, you need to learn this material when you're learning. So I want you to know what SBAR is. It stands for Situation, Background, Assess, and Recommend. Okay, it's a really commonly used communication framework. A lot of the hospitals will have a pad at the phone with SBAR written on it. Okay, this is a standardized way for a professional to convey critical information quickly and clearly during a patient handoff or when you're reporting changes. It's to organize your thoughts and ensure that all the information is communicated. I'm going to just kind of give you an example. I'm going to use Fred Flintstone, the cartoon character, because it works well and everyone laughs. So I would say to you, if I were handing off report to you, I'm sending you Mr. Fred Flintstone. He's a 59-year-old worker in a rock quarry. His wife's name is Wilma. The situation going on here is he runs his car and doesn't wear any shoes and had some scratches and wound issues for his feet, which we are changing the dressings on. You know that Fred Flintstone runs his car with his feet, right? And then I would go on in an assessment. I would give you the vitals. I would give you what the feet look like, if he's alert and oriented, and any recommendations. If I change the dressing before I go and it's been being saturated every so many hours, I would let you know that he may need change before you go home tonight after you get him. And it's a way to, now, a lot of times when I've been in nursing homes, they go, he's fine. Mr. Jones is fine, Mr. Flintstone's fine, but this is a way, if you're transferring someone more critically ill, you need to go to this SBAR. And it's something you should kind of know. It's to organize you and make sure everything's communicated effectively and you get all the information. And I will try to get, those of you that I'm going to have in class, I'll try to get you a sample of that phone chart that people use where you can write out the SBAR and you can practice it. But it's something that I definitely want you to know what that is. I also have seen SBARR. I don't really use that, and I thought that was a little too complicated for what I was working on here for you today. So I did have this mini case example here to just kind of give you an example of when you might use all these things that we talked about. So the scene is we're educating a patient with newly diagnosed diabetes. We're going to approach him authentically. We're going to assess if he's ready and use therapeutic communication with him. We're going to use clear, easy language. I'm going to demonstrate glucose monitoring. I'm going to allow him to return the demonstration. He can even check my finger if he needs to, if he wants to check my glucose. I'm going to provide some resources for him, who to call if he's having problems. I'm going to provide some education for him. What should he do if he drops under 70? The bottom number is 70. What are some good foods that you can use that are quick sugars that you can raise your blood sugar? What would be a number that was too high that he would need to call the office and ask for help? So I'm going to look at him holistically. I'm going to do authentic discussions with him, and I'm going to use therapeutic communication with him when I teach him.